kid's got a runny nose, fever, cough, feeling run down. Is it a common cold, or is it time to go see the doctor? Maybe it's a sinus infection, ear infection, things like that. Dr. Kristen Bensick, pediatrician at Bayshore Pediatrics, Children's Wisconsin, is here now to kind of help us sort that out. These are hard questions for parents because you don't always know, particularly if you got a real little one who can't really fully explain symptoms. So let's go through what we're looking at and how we can kind of tell the difference.
Sure.
As far as cold, runny nose, fever, things like that, so what are we looking at there?
So all infections generally in kids tend to start with a fever and cold symptoms. When you really start worrying is, if it's going on beyond, if the cold's lasting more than 10 to 14 days, you should take your child in and have them looked at. Or if they have a fever at the beginning, it goes away and the fever comes back, we always worry about a secondary infection like pneumonia or, an ear infection.
So how, I guess you'd said a couple of weeks. I mean, sometimes these things can come on quicker though. Are there particular indications, pain or other things that's maybe early on in the process where you think like, no, probably should go and see somebody?
Right, well, we're in the midst of influenza right now. So if your child has high fevers, body aches, chills, shakes, bring your child in sooner rather than later because the antivirals need to be started within 48 to 72 hours to be effective. So that's really important that if you are thinking your child has flu, please come in. If your child just has a cold, please don't come in.
Right.
Call your doctor first because there's a lot of stuff we can do at home and not expose your child to the other kids in the waiting room who might have influenza.
I know another challenge for doctors is if you've gone to the doctor, you feel like you need some medicine, right? I've come here, so I think you see patients probably who maybe just have a cold and they're waiting for what are you going to prescribe, and there's nothing to prescribe for that cold,
Yes.
right?
Unfortunately, antibiotics do not help colds. And we really don't want to over-treat because we're getting a lot of antibiotic resistance. So if you have a little baby at home, saline, suction, steam. If your child's a little bit older, have them blow their nose, do the nasal rinses, do a lot of, humidified air. That really helps. If you have questions though, please call your doctor. We're always here to help.
All right, great to see you again, doctor, and good luck in the fight with the flu. I hear it's bad this year, huh?
It's been really rough season so far, but get your flu shot, it's still helping.
Okay, good to know.